Hi, my name's Haley. I'm going to perform a head, ears, eyes, nose, mouth, and throat exam. When I'm about to perform this exam, I will gather all my supplies needed before I walk into the exam room. When I do, I will make sure to provide privacy for my patient. I'll wash my hands before touching them. Also, while doing the assessment, I'll be able to assess their hearing and speech, level of consciousness, orientation, their eyes, their eye contact, their level of consciousness, and also their appearance, skin tone throughout the whole assessment. And also I'll be able to see at first general observation if they have any visible disformities. And then also I'll assess their personal hygiene, their posture and mood, and their nutritional status as well. So whenever I start, I'll introduce myself and tell you that throughout this exam I will be in your personal space just a little bit, but it'll only be for a moment. If you feel uncomfortable, just let me know. And also I will tell you before I touch you. So I'll start with the face and the head. The head has regular shape and size and is appropriate for their body. On the face, I'll make sure the skin has even coloring. There's no swelling, no redness, no edema. At this point, I can know if they have any piercings, any scars, any acne or blemishes, or freckles even. So on the head, the scalp and the cranium, or the hair, scalp, and the cranium, I'm going to go ahead and touch your head now. And when I'm feeling throughout their head, I'm going to feel for any lumps, bumps, bony prominences, or any tenderness throughout her head. Her hair as well, to make sure that the scalp's not dry, has dandruff, or anything of that nature. She checks out. Then I'll look at her temporal arteries, make sure they're not protruding. And I'm going to go ahead and touch her temporal arteries. And so feel for those. They should not be tender or hard, and hers are not. Also, I'll check your temporal mandibular joint, which is just where your jaw touches your skull. So I'm going to touch that and have you open and close your mouth. Perfect. And so when she does that, I will test to make sure that it's a smooth motion, no jerking, and that there was no pain associated with that. Also, I assessed her face to make sure there was no swelling or edema, including her sinuses to make sure there's no swelling there, and I'm going to go ahead and palpate those. Her frontal and also her maxillary, and they're not swollen, no bumps, no clogs, anything like that. And then I'll look into her eyes, look at her eyes, make sure her eyebrows are symmetrical, eyebrows are intact, there's no lesions, no scrapes, any redness. Her eyeballs are symmetrical as well. Her eyelashes are intact. They protrude out and up. Her irises and pupils are both flat, regular, round, and the irises are even in color throughout. Next, I'm going to check the conjunctiva and sclera. So what I'm going to do is I'm going to pull down on your eyelids, and when I do, just look up at the ceiling. So I'll look down. Perfect. Her conjunctiva is pink, translucent with veins, and then her sclera is white and shiny. There was no foreign objects, no swelling, redness, and no discharge coming from her eyes. So I'm going to look into your corneas now, which means I'm just going to shine this light into both of your eyes. So I'll have you look at my nose again. Great. And so when I looked at that, I was checking to make sure her cornea was smooth and intact and shiny as well, and it was. Next, I'm going to check her cornea reflection test. So I'm just going to shine this light at your eyes, and you just keep looking at my nose. Great. So when I did that, I was checking to make sure that both of her corneas had a reflection, which showed that she had reflections in her pupils, and they both did. I'll do the 6-point test. So I'm just going to point my finger, and you just follow with your eyes. Midline. Great. And so she was able to follow, no jerky eye motion. She had a fixed stare the whole time. And so I'm going to have you look at my nose this time, and can you cover one eye and still look at my nose? Perfect. And then cover the other. Great. And so you can let go. So I was watching the exposed eye to make sure that it still had a fixed stare and did not wander, jerk, or drift. And neither of those did. I can do a red eye test as well. If I had an ophthalmoscope, I would hold it in my hand and shine the light into her eye one at a time, and I would see a red line, or red dot, which is a reflection of her inner cornea. And I would follow that red dot up into her eye and keep looking and be in her personal space for about a minute or so. And then once that is over, then the test would be complete. I could do a Snellen test as well. If I had a Snellen chart, I would hold it about 20 feet from my patient, eye level, and they would cover one eye at a time and read as many letters as they could. This would be a vision test, and if they had difficulty with it, some of the symptoms would be leaning or squinting while reading. So yeah. Then I will check her ears next. I will do look at her external canal, make sure that there's no swelling, redness, and that both are symmetrical as well. When I look into her ear, I'm going to pull back and up, and if she was a child, I would pull back and down. So when I look, I will pull back and up and look into her ear and let her know. Perfect. And I would do that into both ears, and when I'm looking at the internal canal first to make sure that there's no redness, no swelling, no abrasions, no drainage, and that it's red. And then look also at her tympanic membrane to look into her eardrum and make sure that the eardrum is intact, that it's white, pearly, and shiny. And then also I'm going to perform a whisper test to check your hearing. So what I'm going to do is occlude one of her ears, say a word, and then whenever you hear that word, just say it out loud. So, baseball. Perfect. And then apple. Great. And she was able to hear both of those and respond. And then also throughout the whole assessment, I'll be watching her face while moving. If she has any jerky motions within her facial features, I would make note of that as well. So next, I'm going to look at her nose, make sure it's midline symmetrical, no redness, swelling, irritation, tenderness. Also, once again, if she had any piercings, I would note that, just like she had piercings in her ear. Make note of that one piercing in her lobe. So I would look into her nose at her mucosa layer and have you look up for this one. Perfect. I would look into that as well on both of them. And so on her mucosa layer, I'm looking to make sure it's red, smooth, and moist. And then on her septum, I would look to make sure that it's not deviated, it's intact, no redness, no swelling, no bleeding. And also then her turbine to make sure that it is intact and no redness, swelling, or bleeding as well. And then I would move on to her mouth, make sure that once again her mouth is symmetrical. Note the color of her lips, make sure it's appropriate with her skin type. Note any dryness, lesions around. So for this part, I'm going to have you open your mouth. I'm going to first look at her buccal mucosa. With this, she will open her mouth, and I could use a tongue depressor, Q-tip, or a gloved hand and open her mouth in order to see it. However, I don't, so I'm going to have the patient open her mouth and hold it out to the side for me to see. So if you open your mouth and pull it to the side just a little bit, great. I'll look in both of those. Perfect, thank you. And her buccal mucosa is red, shiny, moist, and smooth. No lesions on the side of it, no bleeding, no swelling. Next, I'll look at your teeth. So if you just smile and open your mouth. I'll look at those as well. Perfect. I'll note that, note if there's any decaying, missing, or disaligned teeth. Also, I know whenever they clench down together, the alignment of those, if she has an overbite or one tooth hangs off to the side. Also, I'd note the color of them. They're white. Next, I'm going to have you open your mouth and I'm going to look at your tongue. So open. I'll look at your tongue. The top of it is rough, smooth, or rough and pink and moist, and then open it to the top. Perfect. The underside is moist and smooth, and you can close your mouth. Thank you. The floor of her mouth is moist and pink as well. I made sure to check the basis to where her tongue meets the back of her mouth to check that there were no white spots or any signs of infection. No lesions, nothing of that sort, no swelling. Next, I'll look at your gums. If you smile again for me, perfect. And just checking that they're even in color, pink, moist, smooth, and the edges stick to her teeth appropriately. And there are no abrasions, lesions, no bleeding, and no swelling in her gums as well. Next, I'm going to have you open your mouth and just look all over. So if you put your tongue down, excuse me, and then say ah, stick your tongue out. Perfect. So when looking in her mouth, I would check her hard and soft palate. I did not check your hard palate, excuse me. So perfect. The hard palate up top was white, no lesions, no swelling. And then her soft palate in the back was pink, smooth, and moist. Her tonsils were pink and moist as well. I would grade them as a 1+ as they were barely showing. Her uvula was in midline and it was a fleshy color with pink and moist. And she stuck out her tongue and said the ah sound, which indicated that cranial nerve 9, 10, and the vagus nerve were all intact as well. So next I'm going to look at your neck. I'm just looking at it. At first I'm going to move your hair just a little bit if that's okay. Thank you. Making sure that her trachea is midline and that she has no lumps, no swelling, bruising, no goiters, anything of that sort. So next I'm going to go ahead and I'm going to touch your in front of your ears, behind your ears, and down your jaw, okay? And I'm going to assess her lymph nodes. So I'm going to go in a circular motion with my fingers, and I'm just going to go front and the back, down one at a time, your jaw, and then down your neck as well. Perfect. And so her lymph nodes are, they had no bumps, so they were small, easily movable, and soft. If they were hard and I felt a lump, I would be concerned and make sure to chart that. Next, I'm going to feel for your trachea, okay, if this is comfortable for you. And I'm just assessing once again that it is midline as well. And so next, I'm going to have you turn to one side, and I'm just going to feel towards the side that you lean, okay? So I'm going to feel right here for some more. Great. And then on the other side as well. And that is for your thyroid, to make sure that it as well did not have any bumps or any hard spots. Great. And then I'm going to change your range of motion. I was following the whole time whenever you were watching my eyes and my fingers and stuff like that. But I'm going to go ahead and have you do a circle with your head. Great. And that assesses that you have full range of motion. And then I'm going to test the strength of your shoulders and your neck. So I'm going to press down on your shoulders and you just resist them. Great. And then I'm going to push on your chin and you push back. Perfect. And again, and that showed that you have strength in your shoulders and in your shoulders and your chin. And that completes the assessment.